Good morning and welcome to New South Wales Health's COVID-19 update for Friday the 4th of June 2021. New South Wales recorded no new locally acquired cases in the 24 hours to 8 p.m. last night. No new overseas acquired cases were recorded in the same period. That leaves the total number of cases in New South Wales since the beginning of the pandemic at 5,401. There were 22,583 tests reported to 8 p.m. last night, compared with the previous day's total of 18,672. New South Wales Health has administered its highest ever number of vaccines in one day, giving 15,410 vaccines in the 24 hours to 8 p.m. last night. That includes 5,521 at the vaccination centre at Sydney Olympic Park. The total number of vaccines administered in New South Wales is now 1,419,005. This includes 477,265 doses administered by New South Wales Health to 8 p.m. last night, and 941,740 administered by the GP network and other providers to 11:59 p.m. on Wednesday the 2nd of June. New South Wales Health is treating 22 COVID-19 cases, none of whom are in intensive care. We are asking anyone who lives in Gundagai, Goulburn, Jervis Bay, Huskisson, Hymes Beach or Vincentia, or has visited any of these areas since the 19th of May, to be especially vigilant for symptoms after 4 travellers who later tested positive for COVID-19 spent some time there. New South Wales Health had initially advised anyone who had been to these venues of concern associated with these cases to get tested and isolated until receiving further information from New South Wales Health. Ongoing investigations by New South Wales Health into the movements of the cases has so far identified that 130 people have been classified as close contacts. All are self-isolating and none of these have tested positive. Please check our website regularly as the health advice for venues may be updated. New South Wales Health has extended for a further 7 days its stay-at-home restrictions for people in New South Wales who have been in Victoria since 4 p.m. on Thursday the 27th of May. These measures are in line with Victoria's restrictions and will be reviewed by New South Wales Health on the 10th of June. Anyone in New South Wales who has been in Victoria, including regional Victoria, after 4 p.m. on Thursday the 27th of May must continue to follow the stay-at-home directions for 14 days or until the order is lifted. For New South Wales residents living along the Victorian border, the stay-at-home requirement will only apply to people who have been outside the defined border region in Victoria since 4 p.m. on Thursday the 27th of May. New South Wales Health urges people who have been in Victoria in the past 14 days to regularly check the Victorian Department of Health and Human Services website for recently added venues of concern linked to the latest cases. If you are in New South Wales and attended any of the venues identified at the times listed, please contact New South Wales immediately on 1800 943 553. We urge everyone in the state to continue to take the practical measures to stay COVID safe, including practicing good hand hygiene, always using the QR codes to check in and out of facilities. Masks are recommended in any situation where physical distancing is not possible, such as in public transport. If you have even the mildest of cold-like symptoms, please come forward for testing immediately and isolate until you get a negative result. There are more than 300 COVID-19 testing locations across New South Wales. To find your nearest clinic, visit our website or contact your GP. Thank you.